Hey everyone, and welcome back to the Diabetic Voice. Today I am going to answer your top questions about diabetes. Whether you've just been diagnosed, have a family member with it, or you're just curious, there's a lot of information out there, and it can be a little overwhelming. So I've gathered some of your most common questions about diabetes to answer them for you in one place. A quick but very important note, I am not a doctor. However, I have successfully managed my own diabetes for over 10 years. The information I'm sharing today is based on general knowledge and is for educational purposes. You should always consult with your healthcare provider for personalized medical advice. Part 1. The basics. What is diabetes? Question 1. What exactly is diabetes? Let's start with the big picture. At its core, diabetes is a chronic condition that affects how your body turns food into energy. Normally, your body makes a hormone called insulin. Insulin acts like a key, letting the sugar or glucose from the food you eat get into your cells to be used as energy. But with diabetes, that system isn't working right. In type 1 diabetes, your body's immune system mistakenly attacks and destroys the cells that make insulin. So you have very little or no insulin. With type 2 diabetes, your body either doesn't make enough insulin or doesn't use it effectively, a condition known as insulin resistance. This is by far the most common type. There's also gestational diabetes, which develops during pregnancy and usually goes away after the baby is born. Now, you may have heard of a fourth, lesser-known type of diabetes, sometimes called type 1.5, or more formally, LADA, which stands for latent autoimmune diabetes in adults. This is a really important one to know about because it's often misdiagnosed. It's a kind of hybrid between type 1 and type 2. Like type 1, LADA is an autoimmune disease. Your body's immune system is mistakenly attacking the cells in your pancreas that make insulin. But like type 2, it progresses slowly. It typically develops in adults, and for months or even a few years, a person might be able to manage their blood sugar with diet, exercise, and oral medications. The key difference is that because the insulin-producing cells are being slowly destroyed, oral medications will eventually stop working. The person with LADA will then need to start taking insulin to manage their condition, just like someone with type 1 diabetes. Question 2. What are the symptoms I should look out for? The symptoms can be a bit subtle, especially in the early stages of type 2 diabetes. The most common signs are frequent urination, especially at night, increased thirst and hunger, unexplained weight loss, fatigue and blurry vision, dizzy or lightheaded and slow-healing sores or frequent infections. Part 2. Diagnosis and management. Question 3. How is diabetes diagnosed? If you have any of those symptoms or if you're concerned about your risk, your doctor will likely run a few simple blood tests. The most common one is the A1C test, which gives a snapshot of your average blood sugar level over the past 2 to 3 months. There are also fasting blood sugar tests and oral glucose tolerance tests that are used. Question 4. Can I still eat sugar if I have diabetes? This is one of the most common questions, and it's a big myth buster. Having diabetes doesn't mean you can never eat sugar again. It's about moderation and making smart choices. The key is to manage your carbohydrate intake, as carbs, including sugar, have the biggest effect on your blood sugar levels. Focusing on a balanced diet with whole foods, fiber, and lean protein is what's really important. Question 5. What is a good blood sugar level? Your target blood sugar levels will be unique to you, and your doctor will set them. But in general, a typical target for someone with diabetes is before a meal, 80 to 130 mg/dl. 2 hours after a meal, less than 180 mg/dl. These numbers are just a guide, so always check with your doctor to find out what's right for you. Part 3. Long-term and lifestyle questions. Question 6. Is diabetes curable? Another huge question. While type 1 diabetes is a lifelong condition that requires insulin, type 2 diabetes can sometimes go into remission. This means that through lifestyle changes like diet and exercise, a person's blood sugar levels can return to a non-diabetic range without medication. However, it's not a cure, as the condition can return if those healthy habits aren't maintained. Question 7. What about exercise? What's the best kind? Exercise is one of the most powerful tools for managing diabetes. It helps your body use insulin more effectively and can lower your blood sugar. The best type of exercise is whatever you enjoy and will do consistently. A mix of cardio, like walking, swimming, or biking, and strength training is great. Question 8. What are the long-term complications of diabetes? This is a serious topic, but it's important to be aware of the potential risks if diabetes is not managed. Over time, high blood sugar can damage nerves, kidneys, and eyes. It also increases the risk of heart disease and stroke. The good news is that with proper management, you can significantly reduce your risk of these complications. So, there you have it. Some of the most common questions people ask me about diabetes. I hope this video helped clear up some of the confusion and empowered you with some useful information. I do have some longer videos on each of these topics, so check them out if you need a deeper dive. If you have any more questions about diabetes or living a healthy life, please drop them in the comments below. I'd love to hear from you. Don't forget to like this video and subscribe for more content like this. Small changes will give you big results. Thanks for watching, and I'll see you in the next one.